Hi everyone, this video is going to be a brief discussion on neuroendocrine tumors of the lung. This is based on Saveston textbook of surgery, and this discussion is going to be mainly with the help of MCQs. With the help of MCQs, we will cover the text and develop a good understanding on this topic. So we will look at the first question. The first question is: carcinoid tumor arises from Kulczycki cells. These Kulczycki cells are also known as Apert cells or APUD cells. APUD stands for what? To answer this question, we need to know the certain facts. We're talking about carcinoid tumors here. These carcinoid tumors arises from Kulczycki cells, as we have already discussed. These Kulczycki cells are also called as Apert cells, and Apert cells stands for amine precursor uptake and decarboxylation cells. So with this information in mind, we can definitely answer this question now. Apert cells stands for amine precursor uptake and decarboxylation. So this is the right answer. Moving on to the next topic, next concept. We have to mark the incorrect statement regarding neuroendocrine tumors of the lung. Mostly we are talking about carcinoids. So before answering certain facts about carcinoids, we need to know that these carcinoid tumors have positive histological reaction to silver staining. That is, they stain positive with silver stain. They're also chromogranin positive. Carcinoid, unlike GIT carcinoids in the lung are not very aggressive. They are the most indolent form of pulmonary neuroendocrine tumor. So they are the most indolent. We need to know this, and this is a very, very important fact to know, that pulmonary carcinoids are not aggressive, rather they're indolent. We need to know that these carcinoids fall into a spectrum, that is the different kinds of neuroendocrine tumor. And the spectrum starts with typical carcinoid being the most indolent, followed by atypical carcinoids, slightly worse, followed by large cell cancer, followed by the worst, that is the small cell cancer. We can remember that the smallest one is the worst one. And if we talk about these tumors, that is typical carcinoids, if we do a proper resection, then 85 to 95% of the patients have a 5-year survival. So with these informations in mind, we solve the MCQ. So in this MCQ, we have to pick the incorrect statement. Option A, they have positive histological reaction to silver staining. This is correct. Along with silver staining, they are also positive to chromogranin. Option B, typical carcinoid tumors are most indolent form of pulmonary neuroendocrine tumor. That is absolutely correct. Most indolent are the typical carcinoid and the worst are the smallest, which are the small cell carcinoma. Option C, large cell neuroendocrine tumors are the most malignant form of pulmonary neuroendocrine tumor, which is wrong. Why? Because the most malignant form is not large cell, it is the small cell. Okay, and with complete surgical resection, 5-year survival rates are less than 50%. This is also wrong. For neuroendocrine tumors, there's a statement which is made by Sebastian textbook of surgery which says that with proper resection 85 to 95% have 5-year survival. Now this is also a wrong statement. Therefore we have to mark the incorrect statements, and in this case the incorrect statements are option C and option D. Moving on to the next question. Yes, we have next question is about carcinoid tumors of the lung. Okay, so we need to know that these carcinoid tumors can present in the periphery of the lung as well as centrally also. Peripheral presentation is there and the central presentation is also there. So this peripheral presentation is the most common presentation. However, central presentation is the most symptomatic presentation. We need to understand that these peripheral tumors are outliers. That means they are away from the center and they're away from the attention, and therefore they do not cause any particular symptom as such. Okay, they are mostly asymptomatic and therefore they are detected later. But those which are in the center obviously causes some kind of airway problem. They can block the airways, cause lung abscess. They can also cause bronchiectasis, and all these problems. They can also cause atelectasis. All these problems can be caused by those present in the center, along with presentation of wheezing. So therefore, the carcinoid tumors which are present near the center, that is towards the airways, are mostly symptomatic. Therefore, and there's another aspect of carcinoid tumors, that is carcinoid syndrome. What is carcinoid syndrome? Carcinoid syndrome consists of constellation of symptoms like wheezing, flushing, diarrhea. These symptoms are present in case of carcinoid syndrome. However, in case of typical carcinoids, this carcinoid syndrome is rare. But in case of a very large tumor or in case of METs, these carcinoid syndromes can be seen. So with these informations, let us solve this question. We have to mark the incorrect statement. Option A, peripheral tumors are usually symptom free, as we have discussed. Yes, this is the correct statement. Central tumors may show endobronchial obstruction. Obviously, this is also correct. Patients may present with lung abscess. Yes, they block certain part of the airways and which can cause abscess. That is also correct. Carcinoid syndrome is very common. This is absolutely wrong. Why? Because carcinoid syndrome is rare. However, if carcinoid syndrome is present, then it is suggestive of a metastatic disease or a very large tumor. So option D is the incorrect statement, therefore the right answer for this question. Moving on to the next question, we have to mark the incorrect statement regarding atypical carcinoid tumor. As I have said that neuroendocrine tumors have this spectrum starting from typical carcinoids to atypical carcinoids. These atypical carcinoids have certain peculiar characteristics. One, they are more aggressive. Okay, and they show lymph node mets, and they also show vascular invasion. After invading the vessels, they usually metastatize to the liver, to the bones, and to the adrenal glands. These atypical carcinoids have threefold distribution. One is the main stem bronchi. Second is the lobar bronchi. And the third are the peripheral or the terminal bronchi. Maximum or majority are present, that is 25 to 75% are present here in the lobar bronchi region, atypical carcinoids. Mainstem bronchi is involved in 20%. However, involvement of trachea is not seen. Involvement of trachea is not seen. So with these informations, we can solve the question. This question is regarding atypical carcinoid tumor, and we have to mark the incorrect statement. So let us see option A, atypical carcinoid tumors exhibit lymph node metastasis. Yes, they are more aggressive. They express both lymph node mets as well as vascular invasion. So this is also correct, and this is also correct. This vascular invasion leads to invasion into the liver, bones, and adrenal glands. Okay. Mainstem bronchi is the most common location in case of atypical carcinoid tumor. This is wrong. It is lobar bronchi, which is the most common location in case of atypical carcinoid tumor. And the most common location in case of typical carcinoid is, yes, it is peripheral. Trachea is rarely involved by atypical carcinoid. This is correct. They exhibit metastasis to adrenal gland. Yes, along with bone and liver. This is also correct. So the wrong answer is C, or the wrong statement. Moving on to the next question. It is about carcinoid tumors. Obviously, we have said that these carcinoid tumors can be present in the mainstem bronchi. It's not like they're absent. They can be present. Okay, so these carcinoids can be present in the mainstem bronchi. So we can easily go ahead, put a bronchoscope, and take a chunk of the tissue and come out, which is called bronchoscopy guided biopsy. But the problem with this approach is that these carcinoid tumors bleeds. They bleed. But there is a statement which is made in the Sebastian textbook of surgery which says even though they bleed, biopsy still to be done. Biopsy still has to be done even if the tumor bleeds. Most of these tumors are sessile, that is, they don't have a stalk. They are sessile tumor. Few are polypoids. Okay, now let us solve this question. We have to find the incorrect statement regarding carcinoid tumors. Option A, diagnosis of carcinoid tumors can be done via bronchoscopy. It is true. Absolutely, it can be done. It will bleed, but it has to be done. Option B, as carcinoid tumors tend to bleed, biopsy should not be performed. This is wrong. This is wrong. Biopsy should not be performed is not correct. Biopsy should be performed even if a bleeder is seen. Option C, most carcinoid tumors are sessile. This is correct. Yes. And option D, most carcinoid tumors are polypoid. This is false. It is sessile. Sessile more than polypoid. Okay. So in this particular case, the incorrect options are option B, which is incorrect, and option D, which is incorrect. Moving on to the next topic, carcinoid tumor of the lung again. So how do we treat this carcinoid tumors? Carcinoid tumors need to be treated with proper resection, and resection done in care by lobectomy. One particular lobe is taken out. Alright, so lobectomy is the most common procedure performed in case of carcinoid. However, if we move towards the more aggressive region of the spectrum, which is the large cell cancer and the small cell cancer, these are very aggressive, and because these are very aggressive, we start treating them with chemo plus radiotherapy followed by surgery. Therefore, for these, chemo plus radiotherapy is preferred modality. We need to know that. So if you look at the question in the first option A, lobectomy is the most common procedure performed, that is the right answer. True. Option B, large cell neuroendocrine tumors are typically treated with surgery. This is false. They are typically treated with chemo and RT. Small cell neuroendocrine tumors are typically treated with chemotherapy. This is true, but a better statement will be chemotherapy plus radiotherapy. And option D, small cell neuroendocrine tumor are unresponsive to radiation. This is false. This is false statement because radiation plus chemo is given in both large cell as well as small cell carcinoma. So the incorrect statements are option B and option D. Moving on to the next question, we are going to now talk about a different variety of neuroendocrine tumor, that is ACC or adenoid cystic carcinoma. These adenoid cystic carcinomas are very peculiar. Yes, neuroendocrine tumors are peculiar amongst all tumor, but within neuroendocrine tumors, adenoid cystic carcinomas are more peculiar. First, we need to know that these tumors, they arise from submucosa. These tumors arise from the submucosa. There are ducts which are present in the submucosa, and these tumors arises from these ducts, and they resemble salivary gland tumors. They resemble salivary gland tumors. They are not very rapidly growing tumors, they are slow growing tumors. But problem is they are more malignant compared to carcinoid syndrome, and one third are metastatic at the time of diagnosis. Okay, one third are metastatic at the time of diagnosis. These ACC tumors typically affect what? The main stem bronchi. It's not the peripheral ones, these are the main stem ones. So now let us try to answer the question. We have to mark the correct statement. Option A exhibits rapid growth. False. They are more malignant than carcinoid tumor. One third are metastatic at the time of diagnosis, but they don't exhibit rapid growth. The tumor itself exhibits slow growth. Alright, so this is not the correct option. Option B, peripheral bronchi is involved most commonly. This is not correct. As we have said, it is typically the main stem bronchi, which is written over here. Main stem bronchi is the most commonly affected area. So option B is also wrong. Option C, they resemble salivary gland tumor. Yes, that is true. They arise from the ducts in the submucosa. Okay, it is not the mucosa, it is submucosa. Moving on to the next question. Here again we have to mark the incorrect statement regarding ACC. All these points we have already discussed, so we will directly go ahead and solve the question. They are more malignant than carcinoid tumors, which is true. Stridor is often present. Okay, we may not have discussed this because main stem bronchi is involved more commonly. Is more commonly affected. Stridor is present very often. Okay, one third of the patients exhibit metastasis at the time of surgery. Option C. Obviously, this is correct. We have spoken about it, so we will mark this as true. And option D, tumor arises from mucosa. Absolutely wrong, because these tumors arises from the ducts which are present in the submucosa. Ducts present in the submucosa. All right. So this is wrong, false. So the correct answer will be D, because this is the incorrect statement. Moving on to the next question. Alright, these are not neuroendocrine tumor, but a little bit about this particular topic, certain benign tumors, an important topic. Most frequent benign tumor of the lung. What is the most frequent benign tumor? This is a one-liner, and we need to know the most frequent benign tumors of the lung are hamartomas. What are hamartomas? Basically, hamartomas mean that in a particular area we have got certain overgrowth of a different kind of cells which are not supposed to be present in that particular area. For example, in this case there is an overgrowth of cartilages. Now these cartilages are not malignant type, they are normal cells, they are normal looking cartilages, but these were not supposed to be here. That is why they are called as hamartoma. So hamartoma basically means an overgrowth of normal tissue in an abnormal location. All right. These hamartomas looks pretty well lobulated, and they are peripherally located, and they are benign. So they are well lobulated, peripherally located. We must know that these hamartomas don't undergo calcification. Calcification does not happen in hamartomas, and these are made up of cartilages. However, in imaging, popcorn appearance is seen. All right. So they are benign. They don't undergo calcification. Okay. There is overgrowth of cartilages, and in imaging, popcorn appearance is seen. Okay, so with this knowledge, we will move on to the next question. We have to pick the incorrect statement regarding hamartoma. Option A, they're the most frequent benign tumor of the lung, which is absolutely correct. It's a one-liner, and it's the right answer. Option B, hamartomas manifest by overgrowth of acinar tissue. This is false. It is not acinar tissue. There is overgrowth of cartilage. They're usually central in location. That is also wrong. They usually peripheral in location. And option D, hamartomas exhibit popcorn appearance. That is correct. However, no calcification. With that, we complete this topic. Thank you so much. If you have any questions or if you have any comments, please do mention them in the comment section.